Hi, good evening, is it good afternoon or good morning? Welcome to this conversation. It's another moment, another minute that we are here. We are still on Mental Health Awareness Month. Yes, and we are almost at the end, but that just gives us more space to continue with this conversation. And it's really cold out there, but we've worked hard to make it warm here.
Yeah. We really
with the presence of one Joan, Victoria. Over to you. Can you introduce yourself?
My name is Joan Wairimu. I'm a clinical psychologist by profession. I'm so glad and happy to be here today. I'm also the director of Do Mental Health Consultancy. Yeah, I'm glad to be here today.
Awesome. My name is Jen Dilla, and I'm the host today. And today we just want to have this conversation for, yes, it has been Mental Health Awareness Month.
Yeah.
Awareness is very relative depending on what do I want to highlight, what is my area, because sometimes you can only highlight good much on what you've been dealing with. So there's been a lot out there, and we really thank God we are happy and excited for anybody who went out of their way just to bring out and share information on that can help anybody relating with mental health conditions, and those who are in need, how to look out, what to look out for, symptoms, causes, all that. I know there's been a lot. But as we wind up the month, although that doesn't mean that we are now ending awareness. No. Be passionate about mental health, because we say there's no health without mental health. So let's continue this conversation. But on today, with the help of Joan, she's going to take us through, yes, you're in this situation where you are the caregiver. And you are the caregiver of not only an individual or a loved one who has a mental health disorder or condition or illness, but just that space of being a caregiver. What is the state of your mental health at any given time? And so as a caregiver, you will be having someone you're taking care of. So maybe Victoria, Joan, I'll keep interchanging that for reasons best known behind the camera. So take us through, how do I realize that I'm a caregiver?
Just like you said, a caregiver is someone who takes care. Yeah? So if you're taking care of someone suffering from mental health or any other long-term illness, you are a caregiver. Yes.
Okay. Have you ever found yourself in a position of being a caregiver?
What I can say is, as a psychologist, as much as we are there to offer therapy and services, we find ourselves also sitting in a position of being a caregiver.
Because by virtue of what you do in the career, yes. And sometimes there's this notion that because you're a caregiver, you have to be strong. You have to have it all collected together. I mean, you can't just afford things like breaking out. But what's the actuality? Kwa ground, how are things when you're a caregiver?
Kwa ground ni tough. Because, when you're a caregiver, you're supposed to be okay. Let's say that. You're supposed to be okay so that you will give, should I say the patient or the loved one, your support, your time, and hope at the same time. But what about you yourself as a caregiver? What do you need? What are your needs? Are your needs also met as much as you're taking care of this person? How is your mental health state? It doesn't have to have an illness, but how is your wellness? Yes.
Maybe like when you're talking about wellness / mental health space, what is normal? Because as a caregiver, one, there's anxiety.
Yes.
Because either my person has a condition I don't even understand, or I'm trying to understand, or it's a chronic illness that is there for some time, is there to stay. And of course we have the hope. So as I'm taking care of them, what is there that I need to look out for in regards to my mental health state?
How are you processing things? Okay. If you want to learn more about your loved one. That's a starting point. But let's say you are working professionally, there's also an aspect, let me say the whole aspect of you as an individual when it comes to taking care of your patient. So the moment you walk out the door, because you leave the loved one behind back at home. So you need to be out there. Who are you when you're out there? And how have you handled the situation back at home? Because again, you might live with the patient with you. Yes, physically the patient is back at home, but you being out there, you are no longer the caregiver, you are the patient. Yes.
Wow, take us through maybe an example.
Let's say I have a patient diagnosed with a long-term illness. Let's say maybe like cancer. Cancer is painful. Cancer is also stressful, financially, emotionally, yes. So when you're out there, probably you have the responsibility of, I need to take care of the medication. You're the same person going to work, yet you're also the same person maybe you're working on. Maybe tomorrow my patient, for example, my husband. My husband is supposed to go for chemo. I'm supposed to be there. I'm supposed to support that person. Yet back at home, you still have kids that you need to take care of. So who are you out there? How are you handling yourself with all that is happening to you? Because you have to be okay mentally, to be in an okay mental space that is wellness of you, so that you can be able to take care of each and everyone in that household, because it's your responsibility. How would you handle yourself when you're out there? Take care of yourself as an important person. You are a priority. You are the glue to this household
that holds everyone together.
Yes.
Yeah.
So you have to also remember that you are a person as much as everything that is happening. You are a person. You also need help. That is the first step. So if you cannot be able to take your husband to that chemotherapy tomorrow, find someone to help you. Delegate. Delegate, so that you could meet all the priorities that you need to do.
And maybe like when you say that, it's coming to mind, and I'm trying to remember. Sometimes I like personally using my life situation. There's a time I was working, of course, in employment, and by then I didn't realize that maybe it was my mental health that was being affected. And so I had a situation with one of my children, and it was like when you leave home, like you're saying, you're at work, but you're at home. And you almost want to call the teacher, you want to ask what is happening. You want to, when a phone calls, when your phone rings, there's a way you jump at it because you want to see. And if it's somebody at home, your heart sometimes skips a bit. And you, by the time you're reaching out for that phone, the thought process is really racing. So maybe what can I look out for? What could be some of the symptoms that maybe I'm not very mentally stable, and I really need to look out at my health, mentally, physically, even emotionally as a caregiver? What can I look out for? What symptoms? What would be happening for me? Because like when you look at the definition of the WHO, my mental health space, one of it is about how do we cope with the normal stresses of life. Now here is someone either who's been diagnosed with either like schizophrenia or maybe with bipolar. I'm not even understanding it, and that's my loved one, and I really want them to get well. So at what point will I realize this is affecting me? What is someone supposed to look out for?
Your everyday activity, how you navigate outside there, in the outside world. Who are you? So probably you used to be an I don't want to use the term extrovert, but yeah, extrovert. An outgoing person, a happy person, a bubbly person. You would walk to work very excited. People would always note that, okay? But now this has been like 2 weeks, 3 weeks, you're getting to your office, you have no energy, there's so much fatigue, your mind is never there. Even when you have, for example, office meetings, like your mind is always away and your name has to be called out. How is your productivity at work? How are you dressing? How energetic are you?
Forget.
Yes. Because when you are not mentally okay, you also forget your is clean the right term to use?
Demeanor, your dressing.
Yes.
Maybe you are keen on your dressing and now you don't care. Nile tu ile ndajipata nayo, because maybe there's even no time.
Like you no longer even take time to iron your clothes. Itu iko sawa, sini kwenda tu kazi. So I'll say you tend to be now highly functional because that is what you're supposed to do, and you are detached away from how you're feeling, your mental thoughts and everything. Yes.
Thank you for that, because sometimes it is said that I could be having a sick person and now I become sick. Is there something like more sicker or sicker than the person who is actually unwell? Because yes, I'm taking care of this person. Sometimes we're discussing with someone and they were like, I don't even understand. Sometimes, and the plea was, especially when we are diagnosing out there, like psychiatrists, maybe ameenda na amekudiagnose, they've done the assessment, and maybe they've come up with bipolar or schizophrenia or major depressive disorder. And you've been given this, again, it's not me. It maybe I'm your daughter, so you are my parent, you're my caregiver. And we've been given this, sometimes it feels like a sentence, like a life sentence. We've been given this scenario, and then maybe they didn't take time to sit us through. Not all, but there are some people come and say, mi niliambiwa tu ni hivi, or maybe even because of denial, they were not ready to hear everything, because you hear schizophrenia and you're like, what have I heard about it? So you shut down.
That's a very big word. What is schizophrenia?
Schizophrenia ni nini?
Na akanipatia dawa.
Nilipatiwa dawa, mimi nilipatiwa hizi dawa na nikaambiwa nikunywe alafu turudi after 1 month. So you reach home, you're my caregiver. I didn't understand. You did, and now woe unto us, we go to Dr. Google and you see all the things there. And maybe that's the point at which now I'm trying to you're trying to understand what is this, and maybe with the not being fully aware of what we are tackling, now then it becomes your condition. Because one, there is the stigma. The stigma out there, maybe that's something we can talk about, because caregiving can be affected by the stigma, the stereotypes out there. People associate the word like psychosis, wendazimu ni wenda wazimu ataenda akitoa nguo, so amechizi. So the fact that you had schizophrenia, you're like, is it the same as wenda wazimu? So maybe all this can actually cloud my space to the point of I'm not even thinking. I'm just thinking about this situation, and when shall they be well? What are the symptoms for they to be well? So to the point of I am now no longer functioning. I am in the world of this person that I'm taking care of. Maybe because of the mental health conditions and the stigma that goes around them, and maybe that's how you find even someone is not taking their medication. Maybe could you highlight for us a bit on the stigma, and maybe how are we to minimize stigma? What is our role in the world as a caregiver to help the society minimize the stigma? So
I'll give an example. HIV in the past, it was really stigmatized. Really stigmatized. Anytime you'll be diagnosed with HIV, you would see it as a death sentence. Like hata nikikunywa dawa, mimi najua tu maisha yangu imeisha. Cancer the same. Like even we have survivors, we have cancer survivors, but you'll find some people they'll always be like, I've been diagnosed with cancer, that's the end of it. So mental health is a condition. It could be long term, and sometimes it can be, it can't be long term. So if you are diagnosed with a long term condition, it's always good to ask questions when you're in the facility. As a caregiver, know what is expected of you. Because you might be diagnosed with schizophrenia. Probably it's the first time you've heard of schizophrenia, and you've been told you're going to take for like this medication for almost the whole of your life. So you're like, why would this person take medication for the whole of his life? And he looks okay. People don't understand, he looks okay. So because you've gone to a psychiatrist, that's the first thing. I've seen a psychiatrist. I've given medication. Sasa hizi ni dawa za madhare. Let me use the term that people use out there. Hizi ni dawa za madhare. Na nimeanza kuona psychiatrist na shrink. Therapist now na shrink. So if people get to know, they'll see if I am crazy. So it's always good to be informed, and I like the way nowadays people are coming out, thanks so much to social media. It can be good at the end of the day, but again, social media can destroy you.
You have to be very careful.
Yes, you have to be very careful. So people have really come out. We have celebrities that have come out. They've said they're struggling with anxiety, they are on medication. Others have said they're seeing therapists. So it's more of knowledge. The more knowledge you have, the more will end the stigma when it comes to mental health. So if you're a caregiver, please get informed. If your patient has been diagnosed with schizophrenia, before you leave the hospital, ask more. What is expected of you as a caregiver? What should you look out for? What are these? Yes, just make sure you know each and everything that your mind needs to know. Ask questions. We'll always give you answers. Always. Google is good. I will not lie. Google is good. Sometimes we have personality tests or assessment tests that people do take online, which is very good. But if you look at the end of each test, if Google finds you with a high percentage of a certain condition, it will tell you, seek professional help. Because you may have done that, but it's not what you're suffering from. Yes.
Yeah, true. That's very true. Thank you for that. So the stigma, to end stigma, starts with those who are suffering, those who are around them, especially those of us who are around those who are suffering any condition. And maybe there is one mental health condition that I've seen sort of wreaking havoc because, again, of the way society picks it. And this is substance use disorder.
Yeah.
Because one, if we don't understand it, tunaanza kusema anajifanya. Hii ulevi yake, kwani yeye ndio wa kwanza kulewa. Wengine wamelewa, wengine tumecontrol. And I have seen a lot of people, by the time their loved one is actually now coming out to seek help, nile amefika mwisho kabisa. Maybe talk to us about the need to seek out, the need to understand that substance use disorder, addiction is a disease of the brain, and the need to seek out help. When do we say ni kujifanya, and when do we say that it is actually a condition? Because now look at the age at which children are abusing substance. We have grade 7s telling you the strains of ile bangi kopoa, ile vile ujui.
Yeah.
You know, ujui.
Marijuana
wako tu hapo, and they're in our houses, and as we just find them reading, we are okay. Because caregivers here will be the parents. And one thing I know about a caregiver is if you go into denial, we mess it more, we rub it more. So maybe talk about substance use disorder as a condition, and maybe as a caregiver, how do I approach it?
Substance use disorder, it comes out. Okay, probably the person who needs help, probably has been suffering from depression, but hasn't been knowing. So the coping mechanism that this person uses is either alcohol or whatever drug that the person will find refuge in. So the more he deteriorates, the more now this person starts speaking out. And more of alcoholics, they tend to show their symptoms when they are drunk, because that's when they speak their emotions, that's when they speak their problems out. So that's one of the key points that people should look into. Don't just see a drunkard, for example your spouse or your parent, don't just see him as an abuser. Huyu atakuja kaa amelewa, hata juzi alivunjika mguu, you know, alianguka, jana alilala kwa mtaro. By the way, I saw a meme. If you find me drunk and I'm in a ditch, achana tu na mimi. You don't know my problems. That is none of your business. Let me sleep in peace. Wow. So people are seeing it as a meme, but when you look at it on the other angle, it's making sense. That is my problem, and that is none of your business. Can't you see this is a person in a situation crying out for help?
Because of the way we are used to perceiving them.
Yes.
Yeah.
Yes. So substance abuse is something that people should look out for, and especially if you know that someone is struggling with, because they really tend to show it.
Yeah.
In one way or another, you'll pick it as a condition, and not just like, you know, when people decide to celebrate, people do drink. Alcohol is supposed to be used occasionally.
A recreational.
A recreational,
Yeah.
you know. So if you find somebody drinking every day continuously, and he wasn't or she wasn't in that scene before, can I use the term scene?
Scene, situation, condition.
Situation, yeah. That person wasn't like that initially, but now things have changed. There's a way she's behaving or he's behaving. He's continuously drinking. If he's not getting the highness that he wants to look for something else to add to that highness. And sometimes when you look at this person, if they're not drunk, they won't sleep.
They're just okay. Yeah.
They won't sleep, and they don't talk. But when they're drunk, they sleep and they talk. So addiction is something very serious that people should look into. So don't just assume that familia yetu ni ya walevi, so hata yeye amekuwa mlevi.
Kwetu ni walevi, si yeye wa kwanza.
Yes.
Yeah, I think that's very important. Thank you so much, Vicky, for that, because substance use disorder, I feel, one, we don't just call him mulevi or addict. Like we say, always seek professional criteria and assessment, because there is a way. What is that the professionals in the field of mental health, what criteria do they use to come up with that you are an addict? There is a criteria. So let's not just label people out there without having the right criteria, or self-diagnose or self-medicate, because sometimes, like for example, comorbidity of substance use disorder, which is addiction or dependency, and depression may go together, or bipolar. So if we don't go for professional help, if we don't seek out professional assistance, then you'll find that that's why sometimes you hear tulimpeleka rehab as a form of wacha akapumzikie huko, atoke huko. So if there is not, even when they reach there, if the criteria is not, the assessment is not clear, and maybe like we pick the substance use and we don't pick the depression, maybe that's when you find that now as a caregiver you want them to stay there for longer. I have seen people saying simumuongeze 1 more month. What is that speaking? Is it the loss of a lost hope, or is it the just resignation to fate, like I don't even understand, or I am tired, or I have fatigue? And then again, as a caregiver, there's a situation that presents when people come out of rehab. We're now, because of the lack of the understanding, maybe we didn't attend the family sessions well, maybe we didn't get enough psychoeducation. You find that we are all walking on eggshells. Tutaki kumkasirisha asirudie pombe. And the person just wants to be, what is this, taken back into society,
and
accepted back in the society. So you find that as a caregiver, one of the basic things is walk with this person. It's okay not to understand everything, because remember, you're not a professional help. And sometimes you don't choose to be caregivers.
Yeah, we don't choose.
Because if I'm your daughter and I get unwell, clearly, first it will be the mother before it is anybody else or whoever is near. If it's husband, it will be the wife. If it's wife, I think it will be the husband. I don't know. Because even look at, if we are to do nurse aides and all that, them they are trained. But about the money, it also comes with a cost. So you'll at one point or another find yourself being a caregiver to any condition. But we were trying to look at the one for mental health, because sometimes I feel like if I am diabetic, there is medication for diabetes. If I am maybe going through chemo, there is medication. And we sometimes don't shy away from talking about that. But when I have an anxiety disorder, I'm not sure of when the next panic attack will come. First of all, the people around me are wondering, what is happening? Why are they behaving like this? Why did they fall? And they've been given medication. The medication itself comes with stigma. So even the way I'm taking it. So as a caregiver, you don't have to be a professional. But when you feel exhausted, look out for help. what else can a caregiver do?
Go for therapy.
Oh yeah.
Go for retreat. Can I say retreat? Take yourself somewhere and relax. As much as I said, delegate, seek help. When it's overwhelming, take some time off. Yes.
Yeah. Sasa na hii uchumi vile itaki rest, what else can we do? Mtu anasikia take a trip, anashangaa Victoria anataka niende trip.
Simanishi uende trip hata mbali.
Because sometimes people think self-care and taking a trip is about just taking a trip. Simplifying self-care down to basics. To basics.
So for example, you might take yourself lunch. Hata kama utakula chips na sausage. And for that time, switch off your phone and sit within yourself and eat that lunch and enjoy it. Sikiliza mpaka taste. Usikie kama utasikia kwa ile pilipili kama kuna vinegar. You know? Yes, just take time and be yourself and be within. Feel about yourself. Be intentional. Yes. But maybe the most important thing, if you're a caregiver na uko na mtu mgonjwa nyumbani, please delegate. Because lazima simu. You always switch off that phone.
Yeah.
So you have to delegate somebody who will take care of the person that you love.
Maybe sort of like if it's maybe in a family, sometimes we want to see, and sometimes we want to be seen as super moms. Super mom, super caregiver, ni mimi, wacha nimpatie food, haezi patiwa food na mtu mwingine, dawa ni mimi ndakuja kumpatia. That by itself is putting expectations and the burden on myself. Maybe the fear of delegating because people don't seem to understand. I think we just need to relax sometimes. And realize that we don't have to be super moms and super caregivers, that it's okay for someone else, of course with training or maybe advice or guidance, someone else to also learn how to do that. And because like for mental health, you may find that maybe they are not bedridden.
Yes.
They are around, it's only that now. And the worst I think for mental health, we say like for if my leg is broken, it's in a cast. We know that mtanishika mnipeleke kwa loo because my leg cannot move and we are taking care of it. But for mental health, it's a scar that no one can see.
Yeah, exactly.
It's a situation that I look okay, but then I am not okay. So sometimes even bonding and just being there, sometimes it's about ministry of presence. Tuko tuno Vicky, and it's okay that I may not understand how you're feeling. Because again, I've had scenarios where maybe people going through depression, people are telling them, just snap out of it. Snap out of it. So Nini, why are you so low? We've done everything we can do. And yet you don't look, sometimes even accused not to appreciate. It's like you're not appreciating that we are loved. What haven't we done for you? Caregivers realize it's not about sometimes what you are doing. We could even be rubbing it and messing it. It's just being there.
Be present.
Be present. Be in the present moment.
Do not insist. Do not insist. I repeat. Do your part. Be present. Share what you have. Give encouragement. Talk about things that will make both of you happy. And if the person is not willing to share anything with you, just let it be. That person, if or she is seeing a therapist, well and good. But if she's not ready to talk about it, don't insist. Do not. I repeat, do not. You will make more harm.
And I like that bit where the caregiver and the person being taken care of, as a caregiver, I want to behave even like the doctor.
Yes.
And I have actually seen people stop others from therapy. Hizo session mbili zinatosha, ni nini ingine ukuambiwa. So caregiver, we can also not be therapists, we cannot be counselors, we cannot be psychiatrists. If it's time for medication na dawa zimeisha, but they even had a scenario where someone was stopped for medication. Unaka uko sawa, umepona, because it's me who is in denial. Hizi dawa tukimaliza za this month hatutarudi zingine.
Hizi dawa umekunywa sana, hii ni mwaka ya pili.
And it could even go for more than that.
So it's a long term.
It's a long time. It's a long time. So I think one important thing, seek out more information.
Yes.
Seek out more information. If the person who is being cared for needs therapy, needs counseling, needs even maybe a talk with either a pastor, someone else, not you. You can't be everything. You can't be the therapist. Ukwe ndio pastor wake. Ukwe ndio. That is actually what will drain you.
Yes.
That is what will drain you. Maybe as we really finalize this a little conversation, which of course will always continue. What's your part in short to struggling, who is feeling like they are lost, like if this patient goes on in this state, then I'll be the next patient?
What I'll say is, as a caregiver, seek information first. Be aware what needs to be done. And for example, let me say example, if it's your daughter or your son that is sick, be the mom. Do not be the doctor. Do not be the aunt. Do not be anybody else. Be the mom that this child needs. Number 3, take care of yourself. That is an important thing. And please speak out when you feel like you cannot handle it. Speak out. Because you know, people outside there, even when you go to hospital, whether you find there's a psychiatrist or no, the doctor that you'll see, just speak out to that doctor, and that doctor will help you. Okay? Yes.
Wow,
That's
awesome.
what I would say.
Awesome. Thank you so much, Victoria. I think that's a wealth of information for people out there struggling. Personally, I've been in the space of a caretaker, and I think it's the greatest challenge when you're a therapist and you're a caretaker and you're a mom. Sometimes you wonder which kofia are you supposed, and sometimes you want to wear all those caps and be the therapist, and again move up, be a doctor, dispense the medication also. But I think, like you're saying, it's just be the mom.
Yeah, just be
Sometimes
the
these
mom.
people just need a hug, just need you to make that meal, need you to be in the, take your shower, take your bath, take your meal, sit and eat. Yes, by you not eating or not taking a shower or not taking care of self may not make them better, may actually make them worse. So thank you very, very much. Once more, Vicky is from Dua.
Yeah, Dua.
Introduce us in 1 minute to Dua. Where do we find you? Where is Dua?
I'll start by saying follow me on social media. I'm on Instagram and Twitter as Dua Mental Health. We are located in Kikuyu. My Kikuyu people, you know where to seek help. We are located in Kikuyu, so reach out when necessary. I'll share my contact. Yes.
Thank you very much. Caregiver or not, we're always taking care of people in one point or another, or will be taken care of. So yes, that's what we've had. Let's take care of ourselves. Self-love is a priority. Thank you very much.
Adios.
Adios.